Okay, welcome everybody to today's webinar presented by the Institute for Health Technology Transformation and ICA and featuring Kelly Lewis, Chief Executive Officer with AlliedHIE. My name is Matthew Rayner and I am the Senior Marketing Manager here with the Institute for Health Technology Transformation. The Institute would like to thank everyone for attending today's webinar. Here at the Institute, we strive to provide programs such as today's webinar that drive innovation, educate, and provide a critical understanding of how technology applications, solutions, and devices can improve the quality, safety, and efficiency of healthcare. We encourage you to visit our website to learn more at www.iHealthTran.com. As a reminder, today's webinar will be recorded and made available for download along with the PowerPoint slides on the Institute's website. Once again, that URL, www.iHealthTran.com, by close of business today. We will also be hosting a brief question and answer session at the conclusion of today's presentation. So please feel free to send in your questions at any point during today's webinar by using the question section on your GoToWebinar toolbar. At this time, I would like to turn things over to our featured presenter, Kelly Lewis. Kelly?
Matthew, thank you so much, and to the Institute for putting this on, and for ICA, Informatics Corporation of America, as a sponsor. I'm really excited to talk to the audience today on something true and near to my heart here in disruptive technology. And wanted to talk about some of the things going on a national perspective and where I see the role of direct email, the new federal healthcare email system, and how that's going to play out. So we'll go to the next slide and we'll get started. And as Matthew mentioned, you can send in some questions through chat, and we'll be pleased to answer them as we move forward here. But today I want to talk about the new federal healthcare email system. This was put forward through the Federal Direct Project. It was more than a 3-year initiative. Folks have been trying to put together a national system for healthcare HIPAA-compliant email for years, if not decades. So we're really pleased to be a part of it. We've been big cheerleaders for this type of system for the past probably 10 years in Pennsylvania. And some quick background, I'm a former Pennsylvania legislator, was very involved in health IT legislation from 2000 on, and I've been running a trade group for the technology industry in Pennsylvania that was very focused on health IT and the various things happening in Pennsylvania and surrounding states. And really when this direct project started to come to fruition at the end of 2011, I started putting together a business plan to be one of the on-ramps, just like happened in the ISP industry in 1992-93, but to be one of the on-ramp companies, and now known as a Health Information Service Provider, an HISP. And I stood up Allied Health Information Exchange Company to be one of those on-ramp companies, and really pleased with how things are going so far. This is still new across the country, a lot of raising of awareness and education on what is the new federal healthcare email system. But right out of the gate, I wanted to mention how this is such an affordable option. Most of our national pricing is $250 per account, per address, which makes it very affordable for both rural and large practices, and it's very easy to use. And because we're following guidelines set by the federal government and through the federal project, it's interoperable across systems, across EMRs, across practice management systems. And it really is going to solve one big problem we've had across America with healthcare, is an affordable way to send data back and forth, patient data back and forth between practices, between pharmacies that's HIPAA compliant, and has a national platform. There's a lot of attractive features to the direct email system, and why we believe it's so disruptive to other mechanisms going on as we speak within health IT, is that the federal healthcare email system doesn't require additional IT expense. It doesn't require IT staffing. All you need is an internet connection. And most people in America in the healthcare industry do have some access to the internet, so that we just become that layer on top of their internet connection. Very light training. This is just as easy to send an email. It's as easy to send a direct email. With the comfort knowing that it's a HIPAA-compliant email system. And with all the companies that are in the mix in direct email, all the upgrades, they happen automatically and seamlessly. You don't need to have a lot of IT integration work, as I'm sure many of you have experienced. When your EMR software or other things get updated, you need to go back and do integration with your existing systems. So the federal healthcare email system solves some of those situations, and we'll go to the next slide. Now, certainly, there's some large organizations in America that have really gone out in front of health information exchange. They're market leaders in their state or region, and they have robust health information exchanges. But there's a lot of folks paying attention to the HIE market and what's going to happen, when the stimulus money goes away in September of 2013. And we believe that there's about 226 HIEs in the country, and many of them have relied on their funding from the government to get started, to get going, to become robust, and many of them are going to experience some challenges when the federal stimulus money goes away. And then there's a whole, maybe 50% or more of healthcare that aren't part of a regional HIE. They either don't have one. We call it white space. There's more than 65% of Pennsylvania is in a white space without a regional HIE for them to join. So federal healthcare email really can start to be an HIE, for using that terminology, for a rural community. So we see a lot of rural hospitals looking at federal healthcare email as a way for them to build connections within their community so they can start exchanging electronic data. And again, in the rural parts of Pennsylvania, whether they have an EMR or not, they can still get on the direct email system and exchange data and have the comfort of secure HIPAA-compliant email. Next slide. We see a lot of specific sectors in healthcare that are still using the fax machine, not only on a daily basis, but they're using it on an hourly basis, if not on a by-minute basis. And the one challenge with the fax machine is you really don't know if the person you sent it to received it unless they call you back or send a fax back and say they got this. There's so many challenges to a fax machine in the modern world that the federal healthcare email system really has a chance to make faxes secondary in most practices. And the one great benefit is it's an authenticated point-to-point communication in direct email, and you also can very easily send back a reply that says, thanks, I got your email. Or you can say, thanks, I have an additional question to ask. What about this or what about that? That's extremely difficult to do via fax, and we believe that the quality of healthcare and some patient safety issues are going to be greatly improved through the use of the healthcare email system. Next slide. One of the big issues with the federal healthcare email system is the network effect. When we started out, there was no one on the federal email system when this first started. In 2012, states have been pushing out their direct email programs either through themselves as a state, like in Kansas, or like in Pennsylvania where they have 4 HISPs pushing it out through those 4 organizations. But the tipping point's very important. It's one thing to sell a direct email account to your first client, but most importantly, you need to sell that client's network. And just like we saw happen in the email system with the ISPs back in 1992 and 1993, you could have an AOL account, you could have a PSINet or a UUNet email account, but you couldn't send to your college friends, your high school friends or family until they also had an email account. So we're experiencing that in the first 6 months here in the rollout of direct email, where a lot of early adopters have their direct email address, but now they need someone to exchange data with. And that network effect is where we are right now. And we believe that history is going to repeat itself. We believe that the federal healthcare email system is so affordable and easy to use that it will gain adoption and traction. And already in Pennsylvania, and I know this is occurring in other states, but some very large organizations like Geisinger Healthcare through their Keystone HIE, they've jumped into the healthcare email system. And that adds, one, instant credibility and validation in the market, but it also adds thousands of users. And those users now are going to start to try and build out their networks. And that, one, creates opportunity for the whole industry to sell to those accounts, but it also starts to provide the second, third, and fourth deep in terms of communication back and forth. And not to be disheartened on that whole side of things, this is brand new. And the email system back in 1992-93 really took a few years to gain the traction and the momentum and that viral marketing effect to now we don't even really remember it now. But to the ISP historians, it took a few years to gain traction, and then it started to grow exponentially. And then services, recognizing that now there's millions of people with email, services like Google, LinkedIn, Facebook all captured that network effect. They gained their traction and created the companies that they are today. Next slide. And I will mention, we believe that there will be a lot of companies in the healthcare arena that will provide services and additional bundled services to the direct market. So things like LinkedIn and Facebook, obviously they'll be different, and obviously they'll be security laden as they obviously apply to a HIPAA compliant email system. But some additional services and capabilities will be added to the basic direct email services that we see today. The most important thing about the federal healthcare email system right now is it's secure. It's HIPAA compliant. And organizations like mine and the other ones in the market are working hard to not only be HIPAA compliant, but to meet and exceed all of the security and compliance issues right out of the gate. This is, again, a great opportunity for organizations large and small to jump onto a system that's HIPAA compliant. And we're excited to be in this mix in the very outset. Next slide. I wanted to spend some time and talk about the total cost of ownership. It's a big word in the technology industry now, and I think organizations, again, large and small, are starting to pay attention to what is the total cost of ownership when you acquire a software or a hardware. And in health IT, especially with the HIE marketplace, in addition to buying an EMR, which many practices have done since the stimulus package started, and there was $55,000 was earmarked on a per physician basis in America. But in addition to buying the EMR software, a lot of other costs started to become triggered. And many organizations, once they installed their EMR, they needed to upgrade their servers. and their computers in their office. In many organizations, once they became electronic, they needed to increase their broadband connection, maybe from a dial-up or a T1 to a fiber broadband connection. And those little incremental costs are a real cost, and they are reflected in the total cost of ownership of an EMR software package. And then as many physician practices, excuse me one second. As many physician practices, now understand, there's a lot of integration costs when you install a system like a practice management system or an electronic medical record. There's integration costs that need to be addressed every single time the software is upgraded, or when you change one of those systems, or there's a merger and acquisition by one of those organizations. There's integration costs that all factor into the total cost of ownership. And that's what makes this federal healthcare system, the email system, so interesting, is that these costs will all be absorbed by the providers like AlliedHIE and still maintain that national price point of $250 per year. That's how the email world works. Is the cost is $20 a month, or whatever that is to get your Verizon, Comcast, or CenturyLink internet connection, and then all those services flow through on that monthly burn, and the total cost of ownership is understood and is quantifiable. But when you factor in the total cost of ownership within the federal healthcare email system, right out of the gate, it's affordable and it's quantifiable. And when organizations start to appreciate the network effect and what they can do to advance the network effect of federal healthcare email, they're going to start to get to that tipping point where they jump in. And then the true cost savings that an email system for healthcare can provide will be realized. And we also, when we look across America, when we look at white spaces without regional HIEs, we need to appreciate that not every user is going to go into an HIE. Some by choice, some by cost factors, some by distance. The federal email system pulls them into the system and gets them using electronics. And one of the big things I see with direct email is it gets healthcare providers from where they are now. And don't get me wrong, there's a lot of organizations way more advanced than what I'm addressing right now. But there still in America are a lot of practices, a lot of different organizations that aren't using electronics, aren't using IT to the fullest extent. And they will benefit by the healthcare email system. They'll jump on and they'll start to realize some of those benefits. And I believe it'll help them move into an EMR decision faster. It'll help them move into other forms of technology that will really be the base work for this healthcare email system. And I covered a lot of ground very quickly, and I think I might be even on my last slide. But you can advance the next slide, Matt. AlliedHIE, we were formed in early 2012. And after spending about 12 years knee-deep in the health IT industry, we formed our company to find and capture some opportunities within the direct email system and also in the health information exchange sector. We are, if not the first, we're one of the first independent, for-profit, and privately capitalized companies in these sectors. We believe access to capital is going to be very important over the next 2 to 3 years. As all these HIEs struggle with a funding model, we'll need private capital coming into the health IT sector for merger and acquisition purposes, but also to stand up some of the infrastructures and integration work that it will be required for the health information exchanges across the country to maintain sustainability. Next slide. We set up Allied Direct. It's our direct email system. It's part of the federal healthcare email system. It's a national commercial strategy. We are started in Pennsylvania. Pennsylvania had a Pennsylvania Direct program that was very attractive for us to start here in Pennsylvania. We also understand the market and have some obviously long-term connections. But we see a lot of growth in other states. We see a lot of opportunity in states that have direct email systems that are run by either the vendor community or the state. But we also see opportunity in some states that don't have as robust direct email systems and plans as, say, Pennsylvania and some other states. We're looking at a lot of the southern states, since we're a northern state. A lot of Pennsylvanians go down south, snowbirds. So we see a lot of opportunity in the North Carolina, Florida marketplace, and Arizona as a really easy use case for direct email. Because many Pennsylvanians right now burn CDs with their medical information and take it down to their Florida physician. And when they come back up north in the spring, they burn a CD and come back up north and give the CD to their Pennsylvania physicians. So we see this as a great way to really solve like a logistical situation between snowbirds going north and south. Oftentimes, they don't get to every single physician office to get the CDs burned. And when they come back up north, there's some unanswered questions in their medical history, medication history that may have changed over the winter months. And instead of sending faxes back and forth or trying to coordinate with neighbors to go pick up different things and mail it, this becomes a very easy solution for snowbirds going back and forth between northern states and southern states. It's probably one of the interesting things about that particular use case is there's very few HIEs in the country that are targeting like two states that are 1,000 miles apart. Like there's no Pennsylvania HIE that's been robust in the Florida marketplace and vice versa. So again, direct email, it's affordable. It makes it happen very easily. Next slide. I wanted to talk a little bit about what we see as the market size for direct email. You know, we've seen reports in the past couple of weeks with the healthcare industry being 12, 13, 14% of the U.S. economy. And obviously with millions of people employed in the healthcare industry. And just taking that number from the U.S. Department of Labor and applying a $200 a year cost for an internet health information service provider easily exceeds $2 billion a year in terms of a national market potential for the federal healthcare email system. Now, obviously, that's on a 100% take rate, but it does create the national market. And as we know, when the internet market started, the numbers on the potential for users in the internet were greatly, greatly exceeded than the business models that the ISPs initially put forward. The adoption rate that when businesses jumped into email, who had been holdouts, many businesses wouldn't let their employees use email. Many of you on the call may remember those days when companies forbid the use of email during your work hours. And slowly that changed to say, for businesses to say, you know, this is a real convenient way to do business. And now there's not a company in America that doesn't run on email or have some type of access to the internet to promote their business. We see exponential growth potential, just like the ISP market in the 1990s, getting to that network effect, getting to that tipping point, and the national market just at that base level at $200 per year, greatly exceeding $2 billion. Now, when you add bundled services, which many of you on the call can appreciate, that basic cable, generally in America, basic cable costs about $20 a month, give or take $5. But very few Americans get basic cable. They get bundled packages. They may get ESPN. They may get HBO or Cinemax. They all usually get access to on-demand, so they can watch movies on demand. And then all of a sudden they bundled in voice and they bundled in data, and the next thing you know, you're paying $200 a month for cable. Doing that math and taking it down to even 50% of the healthcare market, when you take something from $200 a year and then make it $2,400 a year, you can easily appreciate the national market for direct email exceeds $6 billion when you include different bundled services that could occur. And I'm sure some of you are on the call are saying, well, at some point, maybe organizations will only use direct email, but then they'd migrate to a health information exchange. And while that may be true for some organizations, we believe that direct email market and bundled services are going to be very, one, appreciated by more than 50% of the U.S. market. And they may not even see a need to join an HIE if they're getting everything accomplished through the federal healthcare email system. So there'll be bundled services. It'll create a national market of $6 billion. And because of the size of that market, large companies, small companies, mid-sized companies are going to enter the HISP market over the next year and help push that network effect, get to the tipping point, and create a market that makes everyone very pleased that they got involved in the direct email project to begin with. Next slide. Well, let me also mention on that slide there, one of the great things about direct email, in addition to being web-based, is it's technology agnostic. So whether you have an EMR or not, whether you have gigantic servers or not, whether you're a dial-up or have 100 meg broadband, direct email works. It's technology agnostic. And that's a very big selling point in the white spaces of America. Next slide. Now, one of the things that we've been fortunate to do was partner with ICA out of Nashville, Tennessee. They've been providing direct email in states and to some regional HIEs. And when we were looking at different companies to partner with, one very attractive thing to us was their direct email system was built on their HIE platform. And for our large enterprise clients, we believe that getting them onloaded to the federal healthcare email system is very important. It helps them right now connect to their client base, but it also positions them to be able to migrate into an HIE solution. And having that occur seamlessly will save our clients time, energy, and money. And we believe that that on-ramp from direct email to HIE is a very valuable opportunity for not only our company, but other direct email companies across the country. And I've often said this in remarks I've made in different speaking forums, that in many cases, if a healthcare provider doesn't go direct, you can be fairly confident that they're not going to go HIE. Now again, I'm not speaking to the large organizations that have had HIEs active for years. They're already into the HIE mix. But for organizations that aren't in an HIE and they're not in direct email right now, I'm fairly confident that if they don't entertain the thought process of what does direct email mean to my organization, and can I afford $200 a year to join the federal healthcare email system, if they can't make that positive decision to join the federal email system for healthcare, they're really going to have a hard struggle saying, well, let's pay $1,000 or some other cost to join an HIE. And that's really where the rubber meets the road right now as we speak in Pennsylvania. Because a lot of organizations are making that decision on whether they go direct or whether they go HIE, or maybe in some situations, what is direct email and what is an HIE? We're still on an educational format. But for many organizations in Pennsylvania, that decision to go direct is their first discussion on the possibility of a HIPAA-compliant way to communicate with their client base and with their referral base. And they're excited about it. And they are enthusiastic to help build out their network and share fax numbers and share email addresses and share snail mail addresses to help build out their network because they see the value. Wouldn't it be great to just be able to send an email back and forth versus faxes, letters, or phone calls? And we share their enthusiasm. We're also very pleased to be working with ICA on what we see is automated direct. Some of our clients are interested in automating certain facets of direct email to provide greater value to them. And also, as I mentioned earlier, the bundled services and what other things could be packaged with direct email to make it more attractive to our clients. Again, ICA's contact information is on the slide there, and I believe on the next slide you'll see some contact information for my company as well. We're AlliedHIE. We're based in Pennsylvania, and I'd be pleased to answer any questions that you may have. And Matt, thanks again for the opportunity to speak today.
And thank you, Kelly. And once again, I would like to remind everyone that today's webinar recording and the PowerPoint presentation will be available on the Institute for Health Technology Transformation's website. Once again, that URL, www.ihealthtran.com, by close of business today. We would now like to open up the presentation to answering your questions, as Kelly mentioned. As a reminder, to submit a question, please click on the Questions tab on your GoToWebinar toolbar. Simply type in your question in the provided chat box. Kelly, our first question from our audience is, what is the total cost of ownership, the first year, the second year, and ongoing?
Hey, that's a great question. It's probably the first question asked of us in every phone call. Our national price, our national pricing schedule is $250 for the first year, $200 for the second year, and $190 for the third year. We've announced our 3-year pricing so that organizations making the decision to go direct fully appreciate what their cost of ownership will be for their first, second, and third year. We put that out. It's been some great discussion around that second year price of $200, but we believe it's important for our clients to understand what we've committed to for them over the 3-year period. For our organization as well, you may terminate your service at any time. We don't have termination fees. There's no service contracts. There's no hidden fees with Allied Direct. You're under no obligations to do your second or third year. And as I mentioned earlier, there's no contracts.
And what other costs can you identify that are also a part of this? Do I have to purchase other equipment? Do I need to consider broadband increases? Any other items?
All you need for the federal healthcare email system is an internet connection and then a computer that can get you onto the internet, which we believe most healthcare organizations for the most part, have across Pennsylvania and America. So you don't need to go out and buy another computer. You don't need to have a separate computer for this system. You certainly don't need to buy any servers, and you don't need to buy any additional software or any other costs. It's a web-based tool. It's technology agnostic.
And what type of technical support is needed for implementation?
Well, again, it's a very easy system. It's not unlike Hotmail or Gmail or other systems. It's a web-based tool. You get a username and a password, and that's what gets you onto the system. There's no technology support that you need. We supply all the technology support. We've got a 24/7, 365 call center. We do all the upgrading seamlessly outside of the physician office, so they really just can jump right on. And literally, we've signed people up in less than 24 hours, start to finish. They can call us, they can get all their questions answered, and we can turn around and give them a direct email address and get them training within a 24-hour period.
And what type of technical support is needed ongoing?
Again, as long as they maintain their access to the internet, and as long as they have a computer that gets them on the internet, that's all they need to do. That gets them right onto the sign-on page. And again, they enter their username and password, and they're on. Now, many organizations, many healthcare professionals use their iPad, their iPhone, their Droids, and their Blackberries. We're mobile compatible. You can take a look at you can take a look on Allied Direct at all your different direct emails on your iPhone, on your Droid, and on your Blackberry. We found some healthcare professionals are very interested in that feature, and we're pleased to offer that as well. But again, there's no, this is a bring your own device type of technology. You just need your computer, and you need access to the internet, and you can sign on.
And are you looking to move outside of Pennsylvania?
Yeah, we presently have some organizations signed up that are in 7 to 11 states, and we're working through strategies to build out their connections in those states. We fully intend to be a national provider and be one of the big champions for the federal healthcare email system. Personally, I've been involved in this effort for years, so I'm really excited to help push it out across the country.
And do you plan on having a service associated with your direct offering to administer the certificate and registration process?
We do. And in some levels, we're automating the onboarding. We're doing a website refresh as we speak. And there'll also be some side services and capabilities to work with all the certificates, authentication. We're rolling out a policy on quarterly authentication of all of our users and with all the other HIEs that we interact with. When I say HIEs, I mean the health information service providers, the HISPs, and form robust protocols in and around the system so that we all can enjoy the success of the HIPAA compliance systems.
And what is Allied's mix of clients right now? Are there hospitals and payers in addition to provider practices?
Our mix, I guess, is maybe somewhat unique, but we've seen a lot of optometrists and optical industry participation across Pennsylvania. We've got a large prescription a prescription benefit manager, PBM. We have the largest behavioral health organization in the state involved. It's been kind of a smattering right now, again, because I believe the industry is so young that we're seeing early adopters stepping forward in disparate industries. One industry that's really caught fire, probably the last 30 days since a presentation was made at a statewide association meeting, but the home health industry in Pennsylvania has really come on strong the past 30 days. We've signed up several home health and hospice organizations over the past week. We see radiology organizations signed up over the last week. And I mentioned in the last week for folks not familiar, but October 31st is the deadline for the Pennsylvania Direct Grant, which provides your first year for free in Pennsylvania for Pennsylvania licensed professionals. So there's a lot of activity, a lot of phone calls, and a lot of activity going on here the past 3 weeks in Pennsylvania as everyone rushes to meet the deadline. Going forward, I really see the optical industry embracing direct email, if only because they're a fax-dominated industry. And I think out of the gate, the fax-dominated sectors will really embrace direct email to get the fax machine out of their system because it's so inefficient. I also see niche practices like radiology that have their amazing PAC systems set up, but they really could use a secure way to communicate reports and communicate back and forth to talk about studies versus trying to catch radiologists on the phone. So I think direct email is going to provide a lot of that communication between healthcare professionals that really is absent. And I'm sure many people on the call can appreciate, try getting in touch with a busy doctor on the phone. It's really hard to do. I remember how it was before email existed on trying to get a busy person on the phone versus just sending them an email. That network effect that direct email is going to provide, when busy healthcare professionals can send a secure email to another healthcare professional, has incredible value to the U.S. healthcare system. Sorry if I got on a tangent there, Matt.
No, not a problem. And what are the software computer requirements?
They're real basic. I mean, if you can get on the internet from your computer, you can use direct email. And I guess I shouldn't be able to get back into what kind of version of Microsoft do you need, but if you can get on the internet and surf the internet, you can pull up our web-based tool, and then you can sign on and put your password in, and you can use direct email. Google or Microsoft or other internet applications will get you onto the internet the way that you can sign on to Allied Direct.
Thank you, Kelly. And unfortunately, that is all of the time we have for today's presentation. I would like to thank everyone for joining us once again to our presenter for today's fantastic webinar. One final reminder, for those interested, please visit www.ihealthtran.com by close of business today to download today's recorded webinar and PowerPoint slides. With that said, we wish everyone a fantastic day, and we look forward to connecting again in the future. Thank you.
Thank you, Matt.